Hey, welcome in. What can we do for you? Cranial nerve exam. No, everything's fine. It's just, I'll be honest, it's not a request we often get. Is something bothering you? Good, good. Yeah, how'd you come up with the idea then? The internet, that's where we get most of them, sure. Providing peace of mind is like 95% of my job. So, yeah, happy to do it. Yeah, this will be fun. I'm not sure we have everything we need to do the most complete exam. But there is a reasonable possibility that we can make do. Yeah, we can figure it out as we go along together. Perfect. Let me get some basic information from you first. Name, please. And date of birth. Okay. Any personal medical history? Okay. And do you take any prescription medications? Okay. Any history of neurologic disorders in the past? No, okay. Have you ever had a stroke? No. Okay. And any vision problems? Okay. Any family history? Medical family history? None. Okay. Either your parents on any medications? Okay. Anyone in the family have a stroke? Neurologic issues? No. Okay. And then eye issues. Grandparents with cataracts. Yeah. Not terribly uncommon, unfortunately. All right, let's get started. Well, cranial nerve 1 is the olfactory nerve. And, well, we need something for you to smell. Let's see. Ah, here we go. It's not noxious and it shouldn't put you off your feet. It's actually quite pleasant. But I will unscrew the cap of the hand lotion, and once you close your eyes and just tell me what you think you smell. Simple enough, right? Okay. All right. And go ahead, deep breath in. Think about it for a minute. What'd you come up with? Lavender, exactly. I have a stressful enough position in this clinic, and well, any chance I can make people feel a little bit more at ease, probably a good chance to take. Let's move on to the optic nerve, and I get to use this, which I'll be honest, I don't use often. So what we're going to do is we're going to do 2 tests. We have numbers here, and then what are called tumbling E's here. We'll start with the numbers, each eye individually, and then move on to tumbling E's. So, let me use my occluder, and we'll cover this eye. We'll have you take a look at the lines, the numbers. What is the smallest number you can read? And anything below that, it's fine. And trade sides here. Smallest number you can read. Any guesses for the one below? Good. Now the tumbling E's. you'll notice that there are E's in different positions. I just want you to tell me which direction the pointy ends are facing. All right, look over this eye. Right, left to right. The lowest you can find. Great. And the other side. Excellent. Put that away for now. I'm going to check your pupils with a bright light. I don't want you to stare directly into the light, but I need to make your pupils move. Before we get started, let's take a look and see how big they are first. All right, so looks like we got 3 millimeters over here, and about 3 millimeters over there. Excellent. Look clear over my shoulder, yeah. Not right into the light, but it'll get a little annoying, I'm sorry. Okay, let's check the consensual response. Yeah, when one eye gets light in it, the other pupil is also supposed to react. And it looks like doing fine on this side. Let's check the other side here. No, the consensual response. Great. Go ahead and blink a few times for me. I know that's a lot of bright lights, so let's get you reacclimated to the ambient lighting. All right. One more gross vision. Look right at my nose. Don't move your eyes. Just tell me when you can see my fingers come into your field of view. Ready? Good. Good. All right. Good. Good. Again, right here, just tell me which side is moving. Yes. Good. Excellent. All right. Stare right at my finger. I'm just gonna have you move your eyes. Don't move your head. I'm sorry, it's I know it makes your eyes go crossed, but it's part of the test. All right, looks like those are all in order. Let's check your trigeminal nerve, number 5. Oh, really? How we check it is, I just touch your face in 3 different places. Simple enough. Yeah, you just have to tell me if it feels the same or different on each side. Cool. All right, let's start. Feel the same, both sides. Okay. Good. And now down here. Perfect. Alrighty then. All right. One more thing. Clench your jaw as hard as you can. Yeah, like you're biting into something really tough. Perfect. Yep. Relax. Let's see. Cranial nerve 7 is typically for taste. Did you have breakfast? Did you taste it? Good. I don't have anything to eat. I'm supposed to keep our food away from the patient area, so. Other thing we could do, I'm just gonna check your tear production. Just look up for me. I'm just gonna take a look at the bottom of your eyelids here. Yeah, looks fine. Excellent. Okay. And cranial nerve 8, vestibulocochlear. You can hear me just fine, but let's do a little bit more testing. I'm just gonna rub my fingers together, one side or the other. Tell me where you feel it, where you hear it. Ready? Eyes closed, please. Great. Good. Good. Right. Tell me how many times you hear something happen. You'll know what I mean. Good. Good. Right. Perfect. That all looks great. Sorry about this one. Cranial nerve 9 is the glossopharyngeal. It's hard for me to test the carotid baroreceptors and chemoreceptors. But I suppose it's also responsible for saliva production. I just have you open your mouth real wide. There is saliva in there. Fantastic. Let's check your vagus nerve, number 10. I'm just gonna put my hand in your throat. I just want you to swallow. Go ahead. Perfect. Yeah, these last couple, it's hard to test really. Number 11 is the spinal accessory nerve. Can you shrug your shoulders? Like somebody just asked you a very hard question. Yeah. Perfect. I'm going to put my hands on your shoulders and I want you to try to push my hands up as I resist you going down, right? Shrug up. Okay, good. Relax. Nice and strong. And cranial nerve 12 is probably the silliest one that I have you do. It's the hypoglossal nerve responsible for tongue movement. You're going to think I'm silly, but stick your tongue straight out at me. And go to the left. And the right. Perfect. Simple enough, right? Yeah, with cranial nerves, you've got you know, especially 12, you've got two on each side, right? So if one of them doesn't work, your tongue will go to the other side, and vice versa. So, yeah, everything looked perfectly normal. Yeah. No problem at all. Yeah, sure. No, it's not silly if you have concerns. Yeah, just because I don't have concerns doesn't really help you that much. It always helps to prove why I don't have concerns, so that you no longer have concerns. Does that make sense? Yeah, no, like happy to do it as long as you're feeling less anxious. Then I did my job. Not at all. Happy to do it. Yeah, come back and see us anytime.